Hi, Jacob. It's great to see you again.
Hi.
Fantastic. I see you brought somebody with you. Who do we have here today?
This is Desiree.
Hi, Desiree. It's nice to meet you.
Hi.
And how are you related to Jacob?
I'm his wife.
Oh, very nice. Very nice. Well, we like to have somebody come in with our patients because it gives them a chance to ask some questions that maybe the patient hasn't thought about asking. And plus, going forward, it's kind of a support system. So that way, if they're having trouble getting to the office or they maybe lose motivation to continue with the treatment plan, their partner can certainly give them some motivation for help. I just want to let you know, Jacob, I've looked over your x-rays and the tests that we ran, and what we found is something that's very common, and it's something that in chiropractic we're very good at taking care of. I've actually emailed you some articles that are evidence-based research that's showing that what I plan to do for you for the next 2 weeks really has a positive impact on what's going on. What I'd first like to do is get Desiree up to speed with what we've been talking about. Desiree, so you know the most important organ in the body that takes care of everything else?
Yes, he told me. The nervous system.
Okay, but it starts at the brain, correct?
Mm-hmm.
And then the brain transmits to every part of the body, the muscles, the organs, everything that allows you to live and breathe. Do you know the structure that takes care of the nerves that goes from the brain to the rest of the body? That's the spinal cord. There's a number of structures in place, and then the nerves leave the spinal cord and they go and they take care of the rest of the body. What happens is over time there may be a number of what we've talked about subluxations, sort of two bones get out of place, and they can be chronic over time and it can compound and it causes what we call degeneration. And degeneration it's a breakdown of the tissue, you have thinning of discs, and then you have nerve function that's altered, and that's what we have here in Jacob's case. He came in talking about some low back problems. He was having some severe discomfort for a period of time, and then he had loss of range of motion. So what we have found is some muscle spasms and a grade 2 degeneration of the L5-S1 disc. So here's some paperwork right here, some literature that shows exactly what degeneration is. And then we have right here what the subluxation causes and the different phases of degeneration. Right now, Jacob's at a phase 2 degeneration. And what we're going to be able to do is we're going to be able to slow that down and reverse it. Okay? And what I've come up with is a treatment plan to decrease the pain acutely and increase your range of motion acutely, so in a short period of time. Okay? So what I'd like to do is I'd like to get you on a 2-week plan where we adjust you 3 times a week. We're going to do some E-stim to decrease the spasming muscles, and do some soft tissue work to increase your range of motion. Okay? The adjustment is $50. The soft tissue work that I'm going to do, it's called ART, Active Release Technique. That's going to be $20 a session. And then the E-stim to decrease those spasms and allow this adjustment to take hold is going to be $20 as well. So it's going to be $90 per visit for the first 2 weeks. We're going to do 3 times a week. Okay? So that's going to be a six adjustments, 6 visits, and that's going to be $360. Okay, are you okay with that?
Mm-hmm.
Okay, and then you just pay as you go. So you know, when you come in, you just pay when you're there before you leave.
You said $90 and 6 visits?
$90 and 6 visits.
So it'd be
I'm sorry.
more like $540?
Yes.
I'm just asking.
Yes, it's $540. My
Okay.
apologies.
Fantastic.
My math was off. So then what we'll do is we'll revalue in 2 weeks and see if we need to increase the adjustments or the frequency of your visits, or decrease the frequency of your visits. Okay?
Great.
Are there any questions?
No.
Mm-mm.
Okay, fantastic.